What is the design of the ECOG 2511? It is actually two studies in one, where the first part of the study is a phase 1 study, looking at the combination of veliparib, which is the PARP inhibitor, with standard chemotherapy of cisplatin and etoposide for patients with newly diagnosed extensive stage small cell lung cancer. And the goal of this phase 1 study, as is well known to all of us, is to establish that this combination of 3 drugs will be safe and tolerable for patients. The second part of the study, or the second study in the ECOG 2511, is the efficacy portion of randomizing patients to receive either chemotherapy alone along with placebo or chemotherapy together with veliparib. And the goal of this phase 2 study is to demonstrate that the efficacy that we see when we add veliparib to chemotherapy is going to be better by at least 37% in terms of progression-free survival when we compare that to patients treated with chemotherapy alone. This is an all-comer study, which is one of the major challenges with small cell. We still do not have a reliable way of subclassifying patients. So we just go by the histologic diagnosis of small cell, and these are patients who have not been previously treated with chemotherapy. It is allowed for patients to have received radiation treatment, provided that we'll still be able to monitor the efficacy of chemotherapy after they receive the radiation. So they should have other sites that were not radiated when they come on the study. Because of some potential side effects observed in other studies with veliparib, patients with brain metastasis at the time of diagnosis will not be allowed to be part of this study. We do not restrict patients in terms of when and how they get their chemotherapy, so it is going to be standard administration of chemotherapy as we all do. What is going to be experimental is whether the patient gets the veliparib or the placebo along with the chemotherapy drug that they get. The good news is the phase 1 portion of the study is now completed, so we know that this 3-drug regimen is safe to give to patients, and the study is now moving forward with the phase 2 randomized portion. It is my hope that we'll be able to provide additional details in terms of the experience with the phase 1 portion of the study at the forthcoming ASCO meeting in June. So the primary endpoint of the phase 1 study as part of the ECOG 2511 is safety and determining what the dose should be in going to the phase 2 portion. So those endpoints have been met. So the phase 1 is completed. For the phase 2, the primary endpoint is progression-free survival in the experimental arm receiving veliparib with chemotherapy in comparison to patients getting chemotherapy alone with placebo.